So this particular session is looking at disability and inclusive practice. So I'm really glad that I caught the end of this last talk, because I think there's definitely a lot of crossover there. I think in this particular session, I really want to start off with thinking about us as individuals. Now, I would never ask anyone to do anything that I wasn't happy to do myself. So there's going to be a bit of an activity, but there's going to be absolutely no, there's no pressure to share anything, and I would be doing the activity alongside you. So I'm happy to narrate from my side. So if you're happy to take part, if you can find some paper and a pen or a pencil, something like that. And on your piece of paper, could you draw kind of the outline of a gingerbread man?
Gingerbread man.
Yes. Bit of a tricky one, but kind of enough that you might be able to write some stuff on the inside.
I'm a terrible drawer, but...
Oh, as am I. You'll never have seen a gingerbread man like this.
No, I used to make my staff laugh because my illustrations are terrible. So did you say gingerbread man and words as well?
So just at the moment, here is my stunning gingerbread man. Oh, hang on a minute, I
can't see that. It's just a background. It seems to have disappeared.
Oh,
no, you've got your showing at the moment. You've got your background showing.
This is very difficult now. Oh, it won't let me do it. I've put a background on. Hang on a minute.
Is mine big enough?
Yes, yes.
It creates a talent. Oh, there we go.
There we go. Okay. So here is my slightly skew-whiffed gingerbread man.
All right. So comfort him.
So luckily, I don't think I look like this in real life, but who knows? So within my gingerbread man, the first thing that I'd like us to try and do is I'd like you to write down 3 things within your gingerbread man that you like about yourself. And that could be like about your appearance, it could be your personality traits, could be something that you've achieved. Just 3 things that you like about yourself. Okay. And as you're doing that, I'd then like you to think, well, to write down inside your gingerbread man, what are 3 things that you haven't yet had the opportunity to learn that you'd like to learn?
Like to know.
Yeah. And then if we start to move outside of our gingerbread man, on any bits of paper, can you choose 3 things that you really like about somebody else? So it might be someone you know, or it might be a trait that you admire in somebody else. Okay. So at the moment, so I have got in mind that I like my eyes and I like my hair. I also like the fact that I'm a caring person. Something that I'd like to carry on learning is more about sign language. I'd like to get better at it, be able to translate. I'd also quite like to learn how to salsa dance. All those years of my mum watching Strictly Come Dancing, I've finally taken a bit of an interest, and I'd quite like to learn how to salsa. I can't think of a 3rd one yet. In other people, motivation. How do people keep up motivation and have the discipline to keep going? You know, I am one of them. Oh, you know, start Monday. Well, there's 52 Mondays, and you know, it doesn't last very long for me sometimes, particularly when it comes to food and drink. So, and also I really admire spontaneity. I am a planner. I am not fantastic at waking up and going, you know what, let's just go to the beach or let's do this. You know, I like a bit of a plan. So that's kind of what we're going for, that kind of idea. So on that theme, have a little think about something that you think, so there isn't a right or wrong, that you think makes you different from somebody else. And the last thing that I'm going to ask you to write down, no, you're not cheating, you're fine, is, it doesn't matter how many you choose, but could you put down just a little short list of some of the values that are important to you, or any hopes for the future that you have? So as you finish off that, my next question, I suppose, is, would anybody be happy to share what they admire about other people?
So other people, I've put self-love.
Okay.
You know, I struggle to love myself at times. I love my love. I think my love's amazing. It's one of my favorite things about myself, but I struggle to love myself. So I think self-love, I really admire from people. Self-confidence, I may come across a confident person, and, you know, touring cities, speaking on stage, stuff like that, I'm absolutely fine with. Have me going somewhere outside my comfort zone and social anxiety kicks in. I'm a nervous wreck and I shed about a stone in sweat because I just can't move further. And you know, I don't hide behind a mask, but I feel confidence comes in different waves and in different scenarios. And I've put laid back and relaxedness because I don't always like lists. I'm not, you know, one of those sort of rigid people. But if I am going out, I like to know when we're going out, what time we're going out, and I want to be able to meet those deadlines as we go forward. And I can't be calm and relaxed about it. I can't go, oh, it's fine, you know, we're running a little bit behind, or, oh, I've just dropped a glass on the floor and I've got water all over my wood flooring. You know, I can't be calm and relaxed about that. And I know there's a place for laid back, and I know there's a place for being not uptight but being responsive. I just admire those people who have that focus on it.
Okay.
Okay.
Would anybody else be happy to share something they admire about other people?
Yes, I am I on mute or yeah? Can you hear me? No. Okay. I would say curiosity. I really engage with people who show curiosity, willing to learn. I also admire people who can pick up and change track. Quite a bit like your spontaneity, but kind of a bit more about responsive to individual needs and interests and what's important at that moment. So yeah, being able to respond to the moment in a calm manner and just change track. I think that's something I admire in other people.
Lovely. So when we look at our gingerbread man, obviously we've only put 3 things down that we like about ourselves. Was that easy or was that hard?
That's really hard because you don't define yourself by 3 things, and you can be very selective on what you choose from those 3 whether it's 3 characteristics or whether it's 3 things or values. It could be anything. So we're not pigeonholed into boxes. We're multiple parts of ourselves in different situations. So I would say that was really, really hard.
Okay. And was it easy or hard to think about other people?
Yes and no.
Okay.
Because we don't know people. So we only present part of ourselves to that person, so you're not going to be able to know them fully. So you can admire some traits, and you can identify what you like about them, but you won't know their full story. So I can't say I'm just being fair.
Okay, so Jade's put in the chat that that you struggled to think of 3 things, but you found it easier to think about other people. And Michelle has said that you found 3 things to like about yourself really difficult, even though you do like yourself. So one of the reasons that I do this activity is because if you in a slightly strange way, when we go about our lives and we're busy on the tube, or we're doing whatever we do, we're very conscious of ourselves, we're very aware of ourselves, and we worry about what people think of us intrinsically. Some of us can cope with it better, but underneath we do tend to care what people think about us. But we're the first to point out everything wonderful about somebody else. So why is it when we step into an educational environment or a work environment that one of the first things we kind of interrogate someone about is what they can't do? Why is that one of the first things that we do? We find out what's wrong with you, if you've got a label, if you've got a need, is there something you can't do, is there something you're not very good at? I find it interesting that that's our go-to thing, when actually, if we were to look at each other's lists, we probably would pop up on each other's lists. Because if I admire motivation and discipline and spontaneity, I reckon at least one of you fit into that. It might be that one of your traits fits me, that I fit one of your things that you admire. Okay, so we all tend to have something that somebody else wants, and when we're in professional environments or learning environments, I think that's a really valuable thing. It's a really valuable thing to be able to go, actually, you've got what I want. You've got that skill. I'm actually not so good at this bit. So let's celebrate that you've got that skill. Now, where we bring in kind of the disability and inclusive practice area of that is when we, particularly, I suppose, in my line of work, so working within a learning skills centre, we're writing these kind of support passports, we're looking at any additional needs that students may have, so that we can work with them to overcome those barriers so they can still get their qualifications and things. It's about looking at, yes, formally, some of these additional needs would be classed as disabilities, but could we actually turn some of that around? Could we actually look at your autistic traits as being a real blessing, a real ability? Could it be that with your dyslexia, you're able to view something totally differently to how I do? So that's kind of one of the conversations that I'm looking at the moment. And as we approach September, and we will get a whole load more students coming through the door, completely individual people who I haven't had the pleasure to meet yet. Some of them are already knocking on the door and saying, I'm really worried about coming because I've got this, because I've got that. Or we've got parents saying, are they going to cope? How are they going to do it? Is it going to work? We've got staff who following on from your previous conversation, they're worried. They're worried. Are they going to be able to meet the need? Are they going to be able to cope with the challenges that that person's personality traits may present, or something like that? We just don't know, do we? There's so many variables. So sometimes I find it easier if we bring it back to basics, if we bring it right back down to the core of who am I and who are you?
And also what's important to that person.
Exactly.
Because that, to me, is often the question that's missed when we're talking to people. What's important to that person?
And often what's important to us, obviously it will be different for each person because we have our own individual desires and our own hopes and dreams. But a lot of the time they're not that far removed. My hope and dream for the future would probably be very similar to that of a young female with Down syndrome. It may be very similar to somebody who has never experienced mental health difficulties. If we were in a room of 100 people, I think we'd be hard pressed to find one person in that room who hadn't had some kind of health condition, who didn't know somebody who had an impairment of some kind, who hadn't been through a difficult ordeal, who hadn't been told at school that they were borderline or a bit mediocre. So every single person we come into contact with will have faced a level of adversity or will have experienced something that's knocked them back down. And more recently in my postgraduate studies, we've been looking at what inclusivity means and what inclusive practice is really about. And I think in my experiences so far, and I've only been in the professional world for maybe 5 or 6 years, so it's very early days for me, but I'm starting to look at it and think, isn't it just about being open to saying hello to somebody and listening? Isn't it just about saying, hi, I'm Josie, this is what I'm interested in, or this is what I think I'm good at, and somebody replying and saying, you know what, that sounds really interesting, I'm actually really good at this, or I had a really difficult experience about 4 years ago, but it really helped me to understand something. Instead of us all being frightened to, as you were saying in that previous conversation from what I caught there, around using certain language and things like that, if we were able to say to each other, oh, actually, I haven't experienced that, would you be willing to talk about that with me? Or that sounds quite scary, would you be able to share that?
Yeah.
Something, it's just something to think about, isn't it? Something to think about how we could improve our just even our day-to-day in interactions. I don't know, I'd like to open it up to people. How do people feel within their own kind of practice and their own kind of environments?
And for me, the biggest thing is listening. I think we all need to be better listeners. We also need to be receptive to suggestions and ideas from the person who may have whatever challenge it might be, and listen to, because they're the experts. And I think that so often is ignored, that we're the expert. Now, I have a profound hearing loss. I have lots of solutions and ideas of what can help. What works for me might not work for somebody else. I would never assume that I have all the solutions, but I'm willing to listen and learn. And as I shared earlier, I've been recently working with two people with sight loss, completely opened up my eyes to the different challenges and different solutions. So what I read up, because I'm preparing a sensory loss training package, what I read up didn't quite match with what I was hearing. And so it's really important that we don't just read, we need to listen firsthand to what people say, so that we can learn from them.
No, that's incredibly that's incredibly valuable, and I think it's very difficult sometimes for people to stop talking and to actually sit there and say, I'll listen. Because I think sometimes we feel like we have to have the answer, or we have to know what to say in that moment. But as you say, we are our own experts on ourselves. I don't think we will know anybody, well, we won't know anyone's lives better than our own. So it's very difficult if we then presume to have all the answers for everybody.
Yeah. And we need to move away from assumptions. That's my biggest bugbear, is assumptions that people make, which is one of the reasons why I'm passionate about Mental Capacity Act. And I do go on about it, but it is so fundamental and basic, and it should be practiced day in and day out in health and social care. And the reality is, from my experience, it's not. People have made assumptions all my life on me, and I, as a result, advocate for others because I see and witness what's happened to them. And that's my biggest message: don't make assumptions and listen.
I would echo that, Rachel. It's the mental. I know this is a bit off the point, Josie, but coming from a background of working in kind of older people's nursing care most recently, the Mental Capacity Act is still ridiculously misunderstood, and I get so irate because it's not a new bit of legislation. So I really don't understand why people still make those blanket assumptions about capacity, and apparently you can't make a decision about anything once you've got a label of dementia and you're in a care home. Not a single thing. So carry on. No,
I'm glad you said that, because I think things like that, they are very much related, in the way that, you know, if a student kind of approaches me and says, I've got ADHD, I will say, that's fine. You know, that doesn't then mean that student can't sit in a lesson for an hour and a half. It doesn't mean that they can't then do something. It's something to be aware of. It's something that may interrupt or that may impact how they learn. In the same way that what you're saying around the Mental Capacity Act, if somebody has got dementia, they have a diagnosis of dementia, it doesn't mean they can't choose what clothes they'd like to wear that day, or what they'd like to have for breakfast, or, you know, what activity they would like to do that day. I think we're very quick, and I say we as society, I think we're very quick to we're very quick to diagnose everybody and not necessarily give them the time to actually tell us what they would like and what would make their experience so much more valuable and feel included. I realise we've only got a couple of minutes left before Leighton takes over. Would anybody else like to feedback on anything before I finish? If not, just to say it's been a real pleasure presenting to you today. I really hope you've enjoyed the session.
Thank you so much for your time, Josie. We really appreciate it. And it's discussions like these that make today such an enjoyable experience, and we're able to share experience with each other. So thank you so much. This is your third session of the day. You're now relieved. We really appreciate your contribution. Thank you so much. I'll give her a little round of applause. Thank you.
Thank you very much.
Take care. We'll see you soon. So we are joined this afternoon by Leighton Osborne, who is the Content and Search Engine Optimization Manager for Log My Care, who will be discussing implementing technology for a happier and healthier workforce. Over to you, Leighton.
Wonderful. Hopefully everyone can see the presentation now on their screens. I'm really delighted to be able to participate today in the festival and come and talk about Log My Care. And also kind of looking at how we can implement technology for a happier and healthier workforce. So yeah, thank you very much for having me. So without further ado, I'll do a little bit of an intro to myself. Thank you very much, Jade, for that first introduction. But I just want to share a little bit about me and my experience of social care. So I joined Log My Care back in 2021, around about 7 to 8 months ago now. And as Jade mentioned, I am the content and SEO manager. And my role is to connect with prospective customers and really showcase how technology can benefit them on a day-to-day basis, from kind of frontline staff all the way through to managers and the people that are being looked after themselves. I have 6 years experience in digital marketing. That's kind of coming from a healthcare perspective, working with healthcare professionals to share their stories and engage with people, and also sharing mental health and wellbeing advice through different mediums, including a podcast that I launched. So yeah, lots of different experiences within the kind of health and social care sector. And I've also got personal experience of social care as well. When I was at university, my granddad was diagnosed with bowel cancer, and unfortunately his health got to a point where he was actually housebound, and both my parents stepped in to become his full-time carers. And the whole experience really got me thinking about how I can kind of give back and contribute to social care on a broader scale. And then when I was looking for different opportunities to do that, Log My Care came along, and I just knew that it was a great opportunity for me to only give back and think about, you know, the ways that I can help support the sector. So yeah, that's a little bit about me. But I won't keep you any longer. We'll go straight into a little bit more about Log My Care and the platform. So we were founded in 2017 by our CEO, Sam, and he really saw an opportunity where technology could be used to really benefit people and actually kind of improve the experience of people within care, be it whatever role you are, if you're the person that's being looked after or the carer themselves. And since that point, we've actually, we're now supporting care providers across UK, Europe and Canada, with 10,000 weekly active residents and 170,000 electronic logs being created for service users every single day. And our mission really is to make person-centered technology accessible to everybody in social care. You know, be it if you're a small organisation or a larger one, you should still have access to tools that make your lives easier. And that's exactly what Log My Care is all about. So we have a starter plan, and that is completely free and always will be. And that's one of the founding principles that when the business was started, that we wanted to make sure that that continued as we grew as well. And it's something that will always stay. So no matter how small a care provider is, they will have access to that. We're also founded on 3 kind of key USPs. So simple, effective and safe. So for looking at simple, we understand that actually people don't have time for lengthy training sessions to be able to kind of adopt technology, and they need to be able to hit the ground running as quickly as possible. So we aim to get everyone set up and running within half an hour of sign up. And the system itself has been designed working alongside care managers and service providers and support workers to make sure it's as user-friendly and easy to use and fit for purpose. So it does exactly what it says on the tin. We're also effective. So we know that from our customers that we can save up to from 30 minutes to an hour for every single team member, every single shift. So if we were to look at a full-time employee, we know that that adds up to 6 weeks every single year that can be saved. And just think about all of those different things that you can do with that time. And our system is also safe. So we know that we can create automatic reports that are accessible 24 hours a day. So, you know, if it's 3 a.m. on a bank holiday, you can access the logs, or you can access risk assessments and care plans for the individual you're looking after, without having to rifle through lots of different paperwork. And our system is completely safe, and everything is stored and it's GDPR compliant. So that's a little bit about about Log My Care and the platform. But we'll dive into kind of the main reason I'm here today is to talk about the sentiment in the care sector. So how are people feeling about their roles, and are they satisfied? Do they want to stay? Do they want to leave? And what's really drawing people into the sector? And how can we look at combating some of the job vacancies that we've seen out in the media that are being reported? So we know that over the pandemic, there has been real drastic changes for those within social care, especially within the last 12 months. We've seen an introduction of mandatory COVID vaccinations that has driven lots of skilled professionals out of the industry and has put additional pressure on the ones that are left behind. And that impact is being felt by those actually accessing services and their families as well. And looking at some of the kind of the reports that are out there as well, out in the sector, a recent report by Skills for Care showed that staff sickness nearly doubled in the adult social care sector during the pandemic, which again really shows the impact that has had on staffing levels. And through our daily conversations with staff, the people that are using our platform, we wanted to see whether or not the kind of real, the zest for caring that we were getting through those conversations was being felt by everybody, or whether or not there was a real negative impact that we weren't picking up on. So we went out and we surveyed nearly 300 care staff from across the UK to see how satisfied they were in their current roles and the support they were being given by local authorities and governing bodies. And we really wanted to kind of pull that together and see what their perspective was on the use of technology and whether or not they were digital at the moment and how they saw technology being kind of implemented full-time in their service. So I'm really pleased to be able to share some of those results with you today. So for the key findings from our research, so we found 3 key aspects that I'll talk to you through in a second. But the first one we saw was that we really identified a workforce that was predominantly happy in their roles. So very different from what we were seeing being reported in the media. We saw on a scale of 1 to 10, 10 being very happy and 1 being very unhappy, that the respondents of our survey actually had an average ranking of 7.9, which is much higher than we were kind of anticipating. And then when we kind of broke that down in a further analysis, looking at people's job roles, it was really apparent that those in senior management positions were much more satisfied than those in frontline roles. So it kind of really highlighted that there was a discrepancy between kind of where you sat within an organisation in social care. The second kind of key finding that we found was that the majority of those that we surveyed were brought into the sector for really altruistic reasons, and I'll touch upon that more on the next slide. But we know that people were joining for the greater good, for kind of things outside of their control that they wanted to contribute. However, we did see that there was a negative theme running through the survey, and that actually the pandemic had really kind of exacerbated some of the things, the unpleasant factors associated with working in social care, like long hours, lack of staff, those open vacancies. So when we kind of began the survey, we wanted to collect a little bit of information about the individuals we were speaking to. So finding out a little bit more about their experiences, how long they'd been in social care, if they'd kind of had career progression, if they'd moved from service to service. And one of the things we wanted to look at were the motivations for working in social care. What's brought people in? And when we looked at kind of attraction, it was really apparent that actually those altruistic reasons were very high on that priority list. So 83% of people felt that they joined because they had a passion for caring for others. And that was followed by making a difference, where 77% of people felt that that was the main reason for them. So there was a real kind of, you can see that there's a real theme for the type of people that are joining social care here. And when we looked at kind of in the day-to-day, what are the things that you really enjoy, that actually it was the social connections with colleagues and clients that really shone through. And again, that really links back to kind of that passion for caring for others and kind of building that rapport with clients and being able to see and sustain that over a long period of time. When we looked at kind of other factors that were important, purpose came out on top for 81% of the respondents, and that was followed by job security and work-life balance. And then when we looked at reward, this is where it gets a little bit interesting. So we saw that actually things that gave you personal gain, like money, ranked really low on the scale. So only 24% of people felt that money was the reason they'd stepped into the sector. Whereas when you look at kind of the non-personal gain, just kind of knowing that the job was done well was the highest response that we saw. So 56% of people felt that that was the key thing for them. So then we know kind of why people have joined the sector, but it was also important to understand why people want to leave. So out of all the people that we surveyed, 4% said they were definitely going to be leaving within the next 6 to 12 months. And of the rest of the participants, 23% said that they were undecided. If we're to look at this on a larger scale, we know that today there are around 1.54 million people working in adult social care. So that if that 4% were to account for them, that is 61,600 people wanting to leave the sector, and over 350,000 that potentially could leave. If those numbers are correct, that would actually leave even a bigger deficit for the job vacancies that are already apparent within the sector. So again, we'd see a huge loss of skills and a huge kind of impact that would have on people in care. So we asked kind of what the stresses were for individuals and kind of what were the things that had really kind of tipped them into making this decision to want to leave. And there was a really clear winner here. Workload was the number one reason. So 45% of people said that they felt that their workload was too high. Understandably, you know, people have left the sector. There's still the same amount of work, but fewer people to do it. So where does that work go? On the existing staff that are left. And understandably, that's going to have a huge impact on work-life balance, which is why we see that as our second kind of largest factor here. You know, understandably, longer hours, less people to cover gaps in the services, and obviously that's having an impact kind of going up the organisation as well. So we really see that these stresses of the pandemic have really kind of exacerbated some of those really unpleasant things within social care. So kind of taking that, it's interesting to see kind of how, when we look at other research that's already out there, if this is also a theme that's seen. So we looked at the health and social care workforce study that was recently released, and there was seen that there was a huge impact on mental health and well-being, and that quality of life had dramatically decreased for everybody that they had spoken to through their survey as well. So our results really kind of support those findings, that actually there's a real negative impact on mental health and well-being being had because of these reasons. So now we understand why people come through into the sector and why they want to leave. How can we use technology to be able to support them to improve their well-being and their job satisfaction? And can we use that to help retain staff and also attract new staff as well to help fill those vacancies? So many of you will know that actually there's a real big drive from the Health Secretary to make social care providers 80% digital by March 2024, with £150 million investment from the government to back this. But right now, you might be surprised to hear that actually 40% of care providers are still completely paper-based, so they haven't made a leap into digital at all. So what can we do to help support them into making that journey and into reaching that target, which is now less than 2 years away? Understandably, we all know that social care is often a sector that's been left behind when it comes to digital innovation. But we really wanted to kind of understand a little bit more about how carers felt about adopting technology in their service and the kind of the culture that came with that. And we wanted to see whether or not there was a generational difference between people that had been in social care for several years versus those who had just joined. And we also wanted to see whether or not there was a difference between the types of roles within services as well. So when we went out and we asked people, 59% said that they felt that as a workplace that they were really beginners when it came to digital. So they'd only just kind of started that journey. Whereas 1/3 of those respondents felt that they were digital experts. They knew exactly how to use digital systems to help improve their service efficiency on a day-to-day basis. And then only 9% of those actually identified as complete novices. So yeah, out of the three, this is still with the 300 respondents that we surveyed originally. So these percentages are reflective of that. So kind of looking at those, it was really interesting to break them down into a generational a trend as well, to further have that analysis. So of the 9% of people that saw themselves as complete novices, Predominantly, these were made up of Generation X and baby boomers. When it's where we looked at digital experts, again, this group is predominantly made up of Gen Z and millennials, who are obviously grown up a little bit more with technology being used from a young age. So how can we spot this gap and kind of fill this with this generation? So we kind of went out and we found the appetite for digital. So we want to know how people really felt. Were they comfortable with using tools, be it wherever they were on their digital journey? And there is obviously a real misconception within the sector that actually people are really technologically averse, which isn't what we found at all. So 67% of people that we surveyed said that they were really excited about the digitalization of the sector and what it kind of had for the future. When we looked at this from more of a generational perspective, we saw that Generation X and baby boomers were less positive. So under half of they only had around 48% agreeing to the statement. Whereas when we looked at it from a job perspective and seniority, senior management were really excited. 79% of those felt very comfortable about the digitalisation of the sector. Whereas if we were to look at frontline roles, only just over half. So again, there's a real distinct difference between the type of role that you have within the organisation. When we asked respondents how comfortable they felt with digital tools in the workplace, on an 11-point scale, we found a mean ranking of around 8.6. Again, we saw a shift where Generation Z and millennials reported a higher degree of comfort, whereas Gen X and baby boomers reported a lower. We also saw, again, senior management roles. So all of the respondents in those types of positions felt more comfortable than the mean. So they were at 9.2, whereas those from frontline were on 8.4, so they were slightly lower than the mean average. When we kind of asked if you actually felt that the care sector needed to become more digital, 3/4 of respondents felt that they agreed with this statement. And again, this was much higher for Generation X. This was highest, this was highest for millennials and actually lowest for baby boomers. And then those in senior management roles felt that their organisation needed to become more digital, whereas actually those in frontline roles, only 63% of them felt that this was needed. So whilst there's a clear appetite for digital within the sector, it's really clear that actually between the different groups, this is very different. So out of the information that we had here, just had a question come in. All of the people that we surveyed were care staff. So we didn't actually survey service users or clients within this particular piece of research. But that is definitely a great point to kind of look for in the future, that we can include those and get their insight into this as well. But yeah, so it was very clear that there was an appetite for digital, but actually this needs to come from the top down. So the people in senior management roles were very excited, but actually those on the front line who probably would actually get a lot of benefit out of this felt that they actually they weren't quite there. They didn't have that enthusiasm as the senior management staff did. So what can we do to kind of help them adopt that and to make that transition, that cultural trend? So I think it's really important that we actually kind of demonstrate the benefits that digital platforms like our own can actually have on employee wellbeing, and making the reasons why they joined the sector very apparent and bringing those back to the forefront of the care they provide. So we know that 83% of people that came into social care joined because they had that passion for caring for others. And what a digital care management platform can do is give them time back. So less time spent on admin and more time doing exactly what they joined the sector to do, to deliver and facilitate that person-centered care. It also gives you that peace of mind. So as a manager, you can see you have that oversight from digital implementation. You can see where exactly everything is running within your service and identify any problems in a more quick and efficient manner than what you could do from paper-based systems. You can access documents, care plans and risk assessments really easily at any time of the day, and you can see exactly what tasks have been completed from your staff. What's also great about digital tools is that you can improve your work-life balance. Technology has allowed us to kind of move into working into a more hybrid model for some services, where managers are able to now work from home and have dedicated out of office days where they can go and focus specifically working on a digital tool. And we know that that can bring about the same level of productivity or even higher. And it allows managers to have that kind of separation between kind of being straight on the front line and give them a little bit of headspace to be more strategic in the kind of implementation of different digital tools within their service. What's also great about digital care management systems is that it really gives you the ability to delegate tasks. You can easily create lists and tasks for your staff to be able to complete during the day. And there's a real clear audit trail for you to see who's completed those and when. It also helps staff feel more valued and take on more responsibility, so they're able to take on more tasks, and you can see them kind of flourish by giving them that responsibility too. So looking at other digital solutions, it's really clear that digital adoption has huge benefits for other aspects of care services as well. So we know that career progression was important to some of the people that we surveyed, and actually kind of bringing that back to the forefront by using e-learning platforms like, for example, Grey Matter Learning or Skills Passport can really open up the door for employees and actually put them at the heart of their own progression, creating personal development plans and really kind of mapping out where they want to go and helping them get there. It also helps employees feel really valued, and kind of you can use tools like Perkbox and Reward Gateway to say, you know what, you've done an amazing job, and these are some of the extra things that we want to give you, kind of outside of your normal kind of financial compensation that you get from the organisation. And they're also really great to kind of highlight again back onto the wellbeing and mental health and bringing that kind of culture and conversation back into the workplace. So kind of adopting meditation apps like Headspace or looking at free CBT courses, you know, kind of sharing those really important mental health resources with your colleagues and kind of opening up doors to say, actually, we're really interested in not only how happy you are from a job perspective, but actually as an individual too. Kind of just to conclude this talk, it's really clear that actually social care has gone through an incredible hard experience through the pandemic, and there's no other way of putting it. But actually, our research does show that there is a workforce that truly loves what they do. They've come in for reasons that are for the greater good, and they want to help people. But there are clear ways that what we need to do is to help try and retain that staff and not lose the skills, and to kind of reduce the impact that we're starting to see because of the pandemic. And a way that we can do that is by adopting technology to help pave the way for a brighter future. And myself and everyone at Log My Care, we are really, really excited to be part of that and help contribute to the digitalisation of the sector, and to help people make that kind of target for 2024. Just want to say thank you so much for listening to me today, and this will be an opportunity to ask any questions that you may have. If I don't get around to answering all the questions, please do feel free to drop me an email after the session, and I'll get back to you in due course. But yes, just thank you so much for having me today.
Thank you so much, Leighton. I'm sorry I missed the beginning of this conversation. I had a phone call that I had to take, family emergency-wise stuff today. I did of the sector. I think it's fabulous. Everyone in the audience, have we got any questions for Leighton and Log My Care? Come on, don't be shy. There's quite a few of us in here. I know Michelle's already asked around the use of data from end service users and endpoint users. I think that is, you know, essential moving forward. I think Jade's asked, could you please send me a copy of the slides to share? Thank you, so we can send them out to everyone. Would that be okay?
Yeah, of course, and we're really happy to disseminate the full research report with all of you as well, if you're interested in kind of having a little bit of an in-depth analysis of the numbers. So yeah, we've recently created that, and we're very happy to pass that on too.
Thank you.
Well, I think there's
Vanda.
Hi, good afternoon, everybody. Good afternoon, Leighton, Adam. I wanted to ask you, have you thought about using this application in other ways at all? Have you got anything else planned, and are you using an app, or how does the system work?
So the system operates from two different perspectives. So we have an online dashboard that managers use and is accessible through a normal web browser. So you can use any device for that. And then we have an app for frontline staff, so for carers and support workers. So they can download that and use their own devices. And then when they go out and deliver care, they electronically log the care that they've delivered via their phone.
Okay, thank you. I would like to speak to you sort of then out of this meeting today. We are looking for a provider, so we have an idea. So
yeah, you're more than welcome
to speak with you. Thank you.
That's not a problem at all. Really happy to run through some more about the system itself and the features that we have, and pass the details on. But yeah, just as a little promo, there we do offer a 30-day free trial for any of our paid plans and add-ons. But yeah, we can talk about that separately.
Thank you, Leighton. Michelle's saying that she can understand managers being keener on it than other staff. I introduced electronic meds at my previous role, and it was definitely keener on it than the nurses. Michelle, as a manager, was definitely keener on it than the nurses, and I think that's on understanding the ROIs, isn't it, of implementing digital technology. I know we're out of time. I just have one question, because I have huge passion around digitizing social care in the future. Where do you see us having care plans at full capacity to be accessible to the people we provide care to? So I'm very conscious about the sudden shift to going digital. We lose the ability for people who are possibly not technologically enabled to access their own care plans. What do you see the future being for those to be able to access their own notes at all times?
That's a really good question. Sorry
to put you on the spot.
No, it's a really good question. So something that we've recently been looking into is consent management, and again, kind of bringing that onus back onto the individual that's being cared for, and for them to kind of understand the plans that are put in place for them and the ways that we can gain consent. So something we've recently just launched is kind of electronic signatures. So for an individual, so it could be me as a carer, sitting down next to the person that I'm looking after and going through their care plan, and for them to digitally sign to understand that, but also understanding that actually individual needs differ between clients, and not everyone will have capacity to physically sign, or the mental capacity to understand that actually the plan's put in place for them. And kind of where we can work with legal power of attorneys to kind of gain that consent as well. And I think from our perspective, we've started to share care and support plans with family members based on the consent that we gain. So family members can access a portal which reduces a timeline for them, very similar to kind of Facebook, if you're used to that app, where updates about the care are provided on a regular basis, and they can access the care and support plans for their loved one. And that's something that actually we could potentially develop further and actually give access to the individual clients themselves. So then that they're aware of exactly what the plans again are put in place for them, because capacity changes across time, and actually trying to remember what you did yesterday, sometimes I struggle. So it can be really difficult to know actually what's changed, have things been updated, when is something going to be reviewed, and actually do I have any questions that as a client that I want to be able to ask about them, and where is that kind of trail, and where is that kind of train of responsibility, and who does that fall with? Because it could be that I have agency staff coming in to see me in my own home, and actually they might not be fully comprehensively aware of all the support plans in place. But as an individual, it's really important that you have complete control over how you're supported, and any way that our system can do that, then that's a win.
No, thank you very much for joining. We've still got comments coming in, but like I said, we can signpost to you. maybe there's something we can do together as the IHSCM and Log My Care. We have many people who are part of our membership. So we have people who use care, people who are related to people who use care, people who are delivering care. We have health partners. And part of our people plan coming up this year is looking at access to care. And part of that is access to digital technologies. So maybe there's something we might be able to put on an information gathering session for you as well, for people that have got a vested interest in making digital tech accessible to everyone. It is the future. It is going to happen. You know, people probably scoffed at the idea of using a quill dipped in ink once upon a day to write, and now look at us with gel pens and biros. So it is coming. It's just making sure that we don't have to learn lessons too many times and we create something spectacular. But Log My Care is fantastic. Go check it out. You know, do have that free option. And a slight plug for my chat show host, Mark Tops, who does write a weekly column for Log My Care as well. So really, really useful. Do go check them out. Thank you so much for joining us last minute today, Leighton.
No, you're more than welcome. Yeah, and if anyone does have any questions, do feel free to drop an email into the hello@logmycare.co.uk email address, or you can contact me directly. My email's leighton@logmycare.co.uk, and I'd be more than happy. But yeah, I will disseminate the presentation and our full research report with you so you can have a browse at a later date.